Namaste, I am Dr. Farhan Sheikh. I am the head of the Department of Pediatric Intensive Care at Rainbow Children's Hospital, Banjara Hills. This is regarding dengue illness, which is now going to be common between the month of July up to the month of September or October. And dengue illness, as we all know, spreads through mosquito. The mosquito Aedes spreads this through a virus. This virus is belonging to the flavivirus family, and when the mosquito bites, the virus enters into the body, and usually within 3 to 7 days period after the bite, the child will develop a fever, and this fever can be usually moderate to high grade fever. And then most of the times dengue is not very severe in children, so in 90% of the cases I would say there will be only moderate to high grade fever with headache, body ache, abdominal pain, and on day 4, day 5 usually the fever subsides. Some rash may come and then that also subsides. So most of the times that's what it is, but in 5 to 10% of the patients it can become a very serious problem, and that is why usually we are so worried about dengue. And it is more severe in those children who are less than 1 year of age, or who are more than 10 to 12 years of age, and who are obese particularly, or who have some other problems like diseases of the liver or disease of the kidney or some metabolic problems. In those conditions, then dengue can become a real threat or real problem. So it is always advised that in between the month of July till month of September, October, if your children develop any high grade fever, it's always better to contact your pediatrician as early as possible. Let them examine and then let them decide whether they want to investigate further and do some blood tests, or they just want to observe. And as I said, in most of the times this is not going to be very severe, so they may not do even any blood test, they may not even admit your child. They may just ask you to just wait and watch at home, give some fluids, lot of water and juices or coconut water or something at home, and observe and give adequate rest and manage fever with paracetamol. Most of the times that will be the case. But if there is a high risk situation, like if your child is less than 1 year, or obese child more than 10 to 12 years of age, or if there is a rash on the body, or coldness of the hands and feet, or any bleeding from the gums or nose somewhere, then the doctor may advise some blood tests, or even may advise you to admit in the hospital. Then you have to follow the advice accordingly.